Dysautonomia is a condition that is widely overlooked, misunderstood, and poorly cared for in today's traditional medical model. As parents, we all dream of a life where our kids are happy, healthy, and thriving, but for hundreds of thousands of families today, when this confusing condition called dysautonomia sets in, their child begins to suffer daily from debilitating issues that range from mood disorders, gut problems, chronic pain, muscle weakness, and more. Dysautonomia is also a significant underlying factor in things like autism, ADHD, sensory processing disorder, seizures, POTS, PANS, and PANDAS, all of which are now seen at significantly higher rates than they were just a few years ago. So while traditional medicine can sometimes offer symptom relief, many parents often wonder if there's something more that can be done to help get to the true root cause and help their child achieve full recovery and optimal outcomes from dysautonomia and all of its related health challenges. So in this video today, we'll explain what dysautonomia is, what causes it to develop, what associated symptoms and health challenges come with it, and why it's often overlooked. And then how neurologically focused chiropractic care may be the missing link to restoring your child's nervous system balance through some cutting-edge new techniques and clinical protocols. For 17-year-old Francesca, health struggles ruled her childhood. She was plagued by seizures since the age of 7, then some worsening fatigue, anxiety, an eating disorder, and constipation all through puberty. Her quality of life went downhill fast, and despite constant medical care, doctors had no explanation for why she experienced such a multitude of symptoms altogether. It often felt like they were simply treating random issues in isolation versus getting to one real root cause. That was until Francesca's mom learned about dysautonomia from a friend, and one trip to a specialized chiropractor changed everything. So, what is dysautonomia? Well, dysautonomia is a breakdown that affects the autonomic nervous system, which is the master control center that manages nearly every organ and system in the body, from digestion and the regulation of inflammation to breathing and blood pressure regulation. And when not functioning properly, dysautonomia throws off the communication between the brain and the body, manifesting in diverse symptoms that differ based on which organs that it's impacting. And the most common symptoms are gut issues, anxiety, heart palpitations, and fatigue, and those are the ones that are related to the most commonly affected systems, which are the digestive system, the cardiorespiratory system, and the brain. Not only do traditional medical doctors and neurologists struggle to properly recognize and effectively treat dysautonomia, they also struggle to explain what's really causing it. Our clinical observations and our research, it highlights 5 main triggers of dysautonomia. First, prenatal or maternal distress, such as a high-risk pregnancy, high-anxiety pregnancy. This exposes the developing fetal nervous system to excessive stress hormones, and that may lead to an underdeveloped vagus nerve or parasympathetic nervous system. Second, birth interventions like forceps, vacuum extraction, and C-sections, those lead to physical injury and trauma that then lead to biomechanical misalignments or subluxations in the upper neck and the mid-back areas, which then negatively impact the function of the vagus nerve and the parasympathetic nervous system once again. This vagus nerve injury, it's without a doubt the most frequent trigger of dysautonomia that we see in practice. Third is altered development or missed milestones. This may leave the brain and the nervous system underdeveloped, off track, and just less resilient and adaptable later in life. Number 4, recurrent infections, ongoing gut issues, chronic inflammation, and the overuse of antibiotics and other medications throughout a child's life. And then lastly, number 5, chronic sensory challenges and anxiety in kids, which triggers a continual stress response and excessive stress hormone production. Over time, those 5 triggers, they cascade into a vicious cycle where that overdriven nervous system, it fails to regulate itself properly, and that is what's called dysautonomia. Once dysautonomia sets in, the patient struggles to properly maintain homeostasis in the body, to regulate their nervous system and adapt to even regular daily stressors and routines. So even though most traditional medical providers, they continue to lag behind in their understanding and the proper care for dysautonomia, there is an entire network of specialists called neurologically focused chiropractors who have a deep understanding of dysautonomia and can provide a drug-free clinical approach that addresses the root cause head-on. This unique and cutting-edge approach, it begins first with a deep dive into the patient's case history to find out if any of those 5 perfect storm risk factors for dysautonomia occurred in the child's life. From there, we then get to the really exciting part, our Insight neurological scans and heart rate variability technology. These scans, they can find and detect the presence of neurological dysfunction and dysautonomia at an incredibly advanced and in-depth level, going far beyond what even traditional medical testing like blood work, MRIs, or even an EEG may reveal. So the most important element of these incredible scans is the HRV exam, which is the gold standard for finding dysautonomia and then being able to track and measure positive improvements in autonomic nervous system function as the adjustments begin and care progresses. The doctors that are in our PX Docs network, they are trained specifically in caring for dysautonomia without drugs, and they know how to use specialized techniques and clinical protocols that seek to restore balance to the autonomic nervous system, to activate the vagus nerve, and over time to help the patient regain an incredible quality of life. To learn more about how dysautonomia and how neurologically focused chiropractic care can be the missing key to drug-free relief and neurological restoration, comment below, send us a DM, or see the link in our bio to learn more.